Family Argasidae Soptic. Family Argasidae Soptic. Genus Argus. Autobis ornithodoros. Species A. Persicus omeginini sevi G. Common name Pholtix. Spinous ear tick. Eyeless tempen. Pholtix. Pholtic genus Argus. Species A. Persicus. Common name Pholtic. Host fowl, turkey, pigeon, duck, geese, ostrich, wild bird. Location adult in crate and services of fowl house under tree. Morphology adult 4 to 10 by 2 6 mm, oval in shape, narrow anteriorly then posteriorly, edge of body sharp, engorged, thick, stay brown, starved, yellowish brown. Small difference between male and female. Genital opening prominent in female than in male. Argus persicus. Life cycle nymph and gorge once during life cycle. Adult feed once a month. Lay egg after each meal. Larva can live without food for 3 months. Nymph and adult survive starvation for 5 years. Effect on host. Worry bird at night, so sleep or bird get affected. Heavy infestation lead to blood loss, resulting into anemia. Egg laying decrease or stop. Can cause tick paralysis in duck. Act as vector for Egyptianella pullarum and Borrelia anserina fall parocytosis. Diagnosis: presence of parasite in crate and services. Control: bird must removed and placed in wooden crate. Larvae drop in 5 to 10 days. Afterward return fall to their quarter, which must be cleaned by them. Spray chicken house with organophosphate or synthetic pyrethroid. Spinous ear ticks. Genus Autobius. Species Omegini. Common name Spinous ear tick. Host dog, sheep, horse, cattle, also goat, pig, cat, man, rabbit, etc. Location nymph and larval in internal ear. Adult in crate of people, underfoot, boxes or stone. Morphology: engorged larva spherical. Nymph widest at middle, narrow posteriorly. Skin mammillated with numerous spine. Adult non-parasite. Pretty shape body. Hypoistome without hook. No spine on cuticle. Life cycle: larva live without food for 2-4 months. Adult does not feed. Effect on the host: large number may be seen on the host. Sucks blood, cause irritation, inflammation which may be subject to secondary bacterial infection. Animal dull or feed, condition loss. Dogs shake their head and scratch their ears. Waxy exudate is seen oozing from the affected ear. In heavy infestation, there might be narrow symptoms: irritability, restlessness, grinding of teeth, perforation of ear, infection of middle ear, and even death. Diagnosis: probe ear for presence of tick. Waxy exudate examination. Treatment: 1 part HCH, 1 part xylol, 70 part pine oil kill larvae. Protect for IM. 1 part 40% chlorine, 50 part pine oil. Amitraz 50 to 20% ear. Take 10% permethrin. Infected set should be treated by use of insecticide spray. Eyeless tempen. Eyeless tempen genus Ornithodorus, species Osevigyni, common name Aedes tympanum pujuthinui. Morphology: body is flattened in and fed specimen, strongly curved dorsally when distended with blood. Differ from Argus in being more globular. Leg sharp lateral margin and not distinctly avoid by hand view from above. Life cycle. Life cycle found in crack and cranny of avian roots, nest rodent burrow and resting place of large mammals. A Savigny larvae has from the leg but do not feed on non-parasitic. Second, nymphaeal stages and adult feed on host. The tick may bite man too. Effect on host. They can suck blood in large quantity and may kill the animal when attacking them in large number. Known to be carried of spirochitosis, can transmit anaplasma marginally. Control: difficult hide in sand and hence difficult to assess. Spraying wall of hut, house and nominal building with residual insecticides. Organophosphate, synthetic pyrethroid are likely to be affected. Applied to animal directly or by providing them with dust bath containing insecticide. Zidodate heart ticks. Buphilus micropulse, one horse tick, tropical cattle tick. Short rostrum B. brevirostrate, a pair of eyes present at the margin between first and second coccyx in male and at the margin of the scutum in the region between first and second coccyx in female. First coccyx has hump on dorsal border and is noted ventrally. Adrenal and accessory adrenal plate are present in male and these plates are having median posterior spine. Additionally, a caudal process is present in males. Festoons are absent and the anal groove is faint. Act as a vector for Babesia bigemina in cattle. Bophilis annulatus, one host tick, similar to B. micropulse. In male, the caudal process is absent. Act as vector for Babesia bigemina in cattle. Hemophysalis by Espinosa, three host tick, short rostrum, eye absent. The second article of the pedipalp project laterally. First coxa has pointed spine. Festoon present. Ventral plate in male absent. Act as vector for Babesia gibsoni in dog. Babesia and Theleria of sheep. Hiloma marginatum H. anatolicum. Two host tick, bond legged tick. Long rostrum, longirostrate. Eye and festoon present. First coxa is deeply bifid. Joint of limb have wide one. Male have adenal and subanal plate. Act as vector for Babesia equi, Theleria annulata, Theleria mutans. Rhipicephalus sanguinus are hemophysaloids. Three host tick, brown dog tick, nail ticks. Brevirostrate. Basis capitulum is hexagonal. Eye and festoons present. First coxa bifid. Male tick show presence of adenal plate with straight median border. Act as vector of Babesia canis, Babesia gibsoni, Heptozoon canis and Erchelia canis. Dermacentor variabilis, three host tick, ornate, eye present, brevirostrate. First coxa bifid, coxa fourth in male largest, in male plate absent, festoon present. Transmit Rocky Mountain spotted fever, Q fever, Toluramia cause tick paralysis. Zooids, ricinas, castor bean tick, anal groove surrounding anus anteriorly postrata, longirostrate, inordinate, eye absent, pastune absent, male with pregenital median anal epimeral and adenal said, transmit babesia divergence, ambyloma maculatum ornate hypergen longirostrate. Second article of pedipalp longer than 1 and 2 pastune present males without ventral plate. Transmit a Hebrium transmit heart water disease in cattle caused by Cordrea rumentum. Effect on the host. Direct effect. Ticks injure animal by their direct biting process. The bite is painful and it annoys the host, especially cattle and dog. The effect is termed tick worry, and this has a adverse impact on production of infested animal. The wound caused by the tick bite predispose the host to blow fly strike. Ticks suck blood and heavy infestation result in anemia due to heavy loss of blood. In hard tick, the female are heavy feeder and one tick can consume 0.2 to 2 ml of blood. In calm, 500 tick can kill the animal. Soft ticks such as Ornithodorus species sucks 1 to 2 ml of blood at a time and kill the animal following an overnight infestation. Tick damage the hide, there is inflammation, swelling, ulceration and itching. Dermatitis result due to the tick bite, especially the longirostrate ticks. The hide is affected and become unfit and is treated as third quality. It is often condemned. The marking on the leather due to the tick bite is referred to as white spot leather. Indirect effect. Transmission of Babesia species, Hilaria species, Anaplasma species, Elysia species. Tick paralysis caused by 46 species of tick in 10 genera, including Argasidae and Gyroides. Host livestock, pet and man. It is an ascending motor paralysis induced by substance introduced into host with the saliva where tick attach and feed. Toxic substance, proteinaceous material produced by salivary gland and secreted into saliva. Some say it produced by ovary, zootoxin, holocyclotoxin, zodies, holocyclus inhibit secretion at neuromuscular junction. Ticks, female sometime name. Incidence depend on number of ticks, period of feeding, area feed. Clinical sign: disruption of motor coordination, brief incubation 5 to 7 days, general malaise, loss of appetite, headache, vomiting, first paralysis of lower extremity, flaccid paralysis, hind limb, locomotor ataxia, erratic bobby gait, muscular weakness, lack of ankle knee and abdominal reflexes, paralysis ascended affect for limb upper body, neck head collapse, death, flaccid tetraplegia, decreased sensory perception, paralysis of chest muscle lead to respiratory failure. Patient is no coordinate, unable to move arm or leg, sit upright, difficulty in speaking, chewing, swallowing. In young children, death occur in 20 to 48 hours. Ticks when removed, recovery is seen, total recovery immediate to several weeks, except in Zooids, holocyclos. In dog presenting all these symptoms, inflammation and conjunctivitis of eye, keratitis and cardiac abnormalities. Treatment: phenoxybenzamine HCl, alpha adrenergic blocking drug. Tick bite allergies. IgE mediate immediate hypersensitivity reaction occur early during tick attachment and feeding. Small large local reaction, systemic shock like symptoms, unusual allergic reaction, nausea, diarrhea, vomiting, edema, and erythema. Toxicosis associated with tick, ornithodorus Sevigny, trembling from the saliva, gassing of teeth, sometime for leg paralysis, edge, truncatum, sweating, sickness which occur in sheep, goat, pig, even dog, which occur in SP, SGP, even dog. Female while feeding increase incidence summer, fever, anorexia, hyperemia, hyperesthesia of skin and mucous membrane, salivation, lacrimation, and moist eczema. No paralysis, cracked skin, screwworm, 75% mortality. Symptom within 4 days of tick attachment, immune for 4 year, toxin and no epitheliotropic anemia. The indirect effect include the vector potentiality of each tick which is given under each genera of tick dealt with. Method of control of ticks. Tick can be controlled by ecological control, biological control, genetic control, chemical control. Novel method of control. Ecological control. Modification of plant cover by removal of regeneration covering or shattering ticks. Sanitation of locally inhabited using acaricide plastering wall concrete on floor. Eradication of rodent host. Other parasites such as pasture rodents, rotation, pasture spelling, rotational grazing, periodical with holding of cattle and strict quarantine control can also be used. Biological control, predators, certain ant, buffagus and bird, example crow, are known to consume ticks. This happens naturally in mixed farming. Parasitism, parasitoid which are parasitic during the immature stage and destroy the host as the immature stage complete its development. The control of ticks by this method is very limited. Significant reduction in ticks population was excreted by Zydopithecus species and Hunter Rellus hockeri. Bacteria such as Bacillus thuringiensis are known to cause tick mortality. Some fungus, example Aspergillus, grew on tick cuticle and caused mortality. Similar Microsporidia nosema act as stomach poison following ingestion by ticks. Botanical. A leguminous plant, Stylocenthis scabra, is known to cause mortality in larval and nymphaeal stage of Bophilis, Mycophilus, and Drypycephalus sanguineus. Genetic control. Sterile male technique, cross between B. micropellus and B. annulatus result in hybrid sterility. Irradiation of ticks also result in sterility. Development of cattle resistant to tick. Clinical chemical control. Traditional method widely employed. The following chemicals are widely used: chlorinated hydrocarbons, DDT, BSC, dieldrin, chloradane, linden have been used extensively. Disadvantage: hazardous get accumulated in environment and body tissue. Milk and meat are found to be toxic. Organophosphate compound OPC, malathion, diazinon, rafazanide, pamper belong to this group. Long mammalian toxicity and mammal residue in tissue. It is advantage. Carbamate, carbaryl, bagon have relatively low mammalian toxicity and broad spectrum characteristics. Synthetic pyrethroids, fermented product of Streptomyces evermycetes with broad spectrum activity covering several ectoparasites. Novel method of control. Use of pheromones. Phenolic pheromones are used as an aid in tick control, using them as attractant to attract ticks to an insecticide treated site or location. Aggregation pheromone with toxophane has been used as a tick decay. These decoys are tied to the tail of the animal. Advantage is that only a small amount of chemical is needed to control the ticks. Use of insect growth regulator. Use of juvenile hormone analog Igdosson in large does contribute to tick control. Vaccines. Tick guards and Gavak are available against B micropulse ticks. Difference between tick and mite. Difference between tick and mite. Tick mite. Large in size, macroscopic. Small in size, microscopic. Parasite in nature. Free living mite are present. Mammillated cuticle present in soft tick. No mammillation. Bristles, scales, satiety present. Eye present or absent. Eye absent. Joint pedipalps, not jointed pedipalps. Chitinous extension of scozy epimers absent. Epimers present. Leg and in claw. Leg and in sugar or caruncle. Festoon present. Absent. Orna, ornamentation on dorsal surface of scutum. No ornamentation. Chitinous plate or shell. Scutum throughout the body divided tick into soft and hard tick. No scutum. Ehlers organ on dorsal aspect of first pair of tarsus in leg for sensory function. No Ehlers organ. Respiratory by spherical. Respire through cuticle. Life cycle of tick involve on the host and of the host nature. Life cycle always in the host skin. Act as vector biological for protozoan disease transmission, not as vector for disease. Thank you.